Hey friends, I dropped on by one of our newest employees, Sarah Justice's office. She is our basic needs coordinator here, and she was talking with Joy, who's a medical student, and I could not help but sit down and go, man, I need to ask them real quick what they're doing. It's pretty cool. I'll let them say it themselves. So let's spin this around. All right, so this is Sarah.
Hi.
Sarah's here, and this is Joy.
Hello.
All right, ladies, why don't you tell me, I'm going to scoot this way so I can get both of you in the frame. Oh, I can't get either of you. Oh, I should have planned better for this. Oh, dear. Okay. All right, there we go. Awesome. Okay, all right, ladies, tell me real quick, what were you talking about a second ago? It's super cool stuff.
We're working on planning our next health clinic for our refugee friends.
Okay, awesome. And Joy, you've been involved since?
I've been involved since January of 2023.
Okay.
So it's coming up on 2 years, I believe.
That's crazy.
Yeah.
Do you remember the first one, what you did?
I do remember the first one. So we were thinking about the kind of health needs that our refugee friends kind of need, their health needs. And we got together with some other medical students. At that time, we had some interns, and so we came up with this kind of the health advocacy group here at City of Refuge, and we started brainstorming ways that we can assess the health needs of our refugee friends, as well as maybe provide some very basic health care in terms of screening for common health conditions, and figuring out exactly what kind of diseases or conditions that our refugee friends are dealing with, so that we can better accommodate them. And so we said, why not just have a health screening event? And we started planning. We reached out to some providers. We reached out to physicians at MU. We kind of consulted different specialties, family medicine doctors. We had some pediatricians. We also had interns that were in the dental school or the pre-dental program at Mizzou. So they brought up, what about dental health? So we found a dentist, and we came up with this idea of our health screening clinics. And so we just basically set up stations here at City of Refuge. We check blood pressures, we check blood glucose levels. We do a basic kind of questionnaire asking people about if they have health insurance, if they have an established primary care doctor, if they know how to make a health appointment, if they have any chronic health conditions, if they have medications, if they're taking the medications. So we did that, and the turnout was pretty great. We had a positive kind of response. We didn't know what to expect, but we saw the need, and we decided to kind of continue that on and see how we can kind of help out just to fill that health gap and those health needs for our refugee friends.
Yeah.
And so far we've had 4 clinics. It's kind of evolved that we have a spring clinic, like health screening, we'll have dental care, we'll have mental health care, sometimes vision and kind of eye care, eye screening. And then our fall clinic, we've worked with the health department in Mizzou, the student-run clinic at Mizzou Med, and the health department has actually provided flu vaccines for us, and so we'll set that up, and we'll also provide flu shots. And so that's been really exciting. So the physicians and all the healthcare workers really enjoy it. They love being a part of it. They love coming here at City of Refuge, and kind of meeting our refugee friends where they're at, and where they feel comfortable. Just kind of bringing that care to them.
That's fantastic. Thank you for sharing that. And you are what year right now?
I'm a third-year medical student.
All right. And you want to do what with your life? Obviously as a physician, but what do you want to use your physician skills?
I think that I'm in between family medicine or internal medicine.
All right.
And so I think I've enjoyed kind of doing this community work. So and part of family medicine and internal medicine is you can become a primary care doctor. You could work in the community. You can provide preventative care to patients, and so that's
Yeah.
kind of what I'm envisioning for myself, because that is my interest, and that's why I've continued working with City of Refuge as well.
Yeah, what I love about this is also, Joy, that you've been, I was there originally at the beginning with that first clinic thing. We're getting off the ground, and then we said, okay, you guys go and run with it.
Yeah.
And, we've had a lot of great medical students come and go, stay attached, help us out, but you've been like the person there every time.
Yeah.
And it's like, I don't think we could shake you if we wanted to. And it's not that we wouldn't. We want to keep you. But it has been cool to see your heart in that. So thank you.
Yeah, of course. It's near and dear to me because originally I'm from Uganda. So part of why I came to City of Refuge, I just showed up as a volunteer. I just wanted to get involved and do anything here that I can help with in any way. But being in medical school and having that knowledge, I've always felt like part of me going into medicine is giving back to, especially here in the U.S., giving back to communities or organizations and communities of immigrants and refugees and people that are coming from other countries, because my family and I, we kind of went through that. We kind of know those struggles.
Right.
It's a different system, so I'm very happy to be here and facilitate that and be a part of this, because it's I enjoy it. It's a passion of mine.
Yeah.
Yeah.
Thank you, Joy. I'm so glad that you're a part of us. And then Sarah, real quick, Sarah, you're new, right?
Yes.
But tell us about what is next for Basic Needs?
Well, one of the things that we're focusing on today is the health clinics that we do with Basic Needs Project. And so our program helps refugees with meeting basic needs, whether it's for the home or we have our food bank here. And with the health clinic, we're able to help them navigate some of those challenges in getting health care. We plan to open this up to some more volunteers this year. So we are looking for other people who want to help us bring this need to our community. We have stations with all these different providers, and so we'll have volunteers helping guide our refugees through those stations and make this more available to our community that we serve.
Yeah. Well, ladies, thank you so much. And to kind of put a bow on it, why is this important? Well, it's important because we want to bring this up that we are looking right now to continue to grow money through Como Gives. So today from 4 to 7 p.m., hop on, and they're doing a power hour for those 3 hours. And that is going to get a prize for whoever raises the most money in that time. So if you're thinking about giving to Como Gives, the link's in the description. We would love to have anything to help us out with this so that we can continue doing more health clinics and helping meet the basic needs of our friends. Thank you so much for helping us love our neighbor and make a City of Refuge.